We need to start talking more about our poop. Stool is cool, and I'm about to tell you how healthy poo equals a healthy you. Hey everyone, welcome back to our channel, Ink Nutrition. My name's Jack, I'm a registered dietitian, and I'm here to help translate the science of nutrition so that you can live a healthier and happier life. Please like, comment, and subscribe for videos every week. Today, we are diving into a topic that is a little personal, but very important. Your poop. We need not to be afraid to look into the bowl, because the reality is that your daily do's can tell you a lot about your health. So let's get to the bottom of this. Here's the scoop on your poop. There are 5 factors that we're gonna look at today to kind of assess your poop. We have color, consistency, shape and smell, frequency, and microbial composition. First up, we have color. So the color of your poop can be a pretty big indicator of what's going on inside your body. We have brown. Of course, this is the color that we want to see. Kind of like a good chocolate bar. Brown poop is a sign that everything is functioning well in your digestive system. Sometimes you may see some green. Okay, if you see green, it could be from eating a lot of green vegetables actually, maybe even some food coloring, but it might also mean food is moving too quickly through your intestines. Then we have yellow. Yellow stool can indicate too much fat in your stool, possibly a sign of malabsorption disorders like celiac disease or a few others. Black, so if you see black poop, this can be due to certain foods or supplements, but it could also mean there is bleeding in the upper GI tract. Definitely worth checking with your doctor if you see this. Then we have red, all right? This could be from eating red colored foods, sometimes like beets, but it might also be a sign of bleeding in the lower digestive tract. Again, this is also a sign that you may wanna discuss with your healthcare provider. We also have white or clay colored poop, and this suggests a lack of bile in your stool. Bile is actually what gives you that brown color. So this could be due to a bile duct obstruction or liver issue, possibly. Okay, so that's color. Now let's talk about consistency. So the Bristol stool chart is a really handy guide to help us understand what different types mean. Types 1 and 2 can be described as hard lumps or lumpy sausage. This usually indicates constipation. So generally speaking, drinking more water, increasing fiber intake, and exercising regularly can help. Types 3 and 4, smooth and soft. These are the gold standard of poop. This is what you're aiming for, normal, healthy bowel movements. And then we have types 5 and 7, can be described as soft blobs or entirely liquid. So this points to diarrhea, and it might be due to infections, food intolerances, or other digestive issues. So there are so many reasons that you may be experiencing diarrhea or constipation, and if it happens, for a day or two, probably nothing to worry about. But if it is persisting and it is chronic, I probably would get that checked out. I would see your healthcare provider or a dietitian for some personalized recommendations. Next, let's talk about shape and smell. So the shape of your poop can be telling sometimes. Ideally, we want well-formed, elongated stools. If you have pencil-thin stools, this could be a sign that you have some bowel obstruction or some narrowing in the bowel. And let's not forget about smell. So while poop never smells good, if you notice that you have a pretty odd, foul smell and it's been going on for a while, it could indicate that you have some malabsorption going on, possibly an infection, or maybe a GI disease. And let's talk about the 4th category, frequency. How often should you be going poop? All right, so if you are going anywhere from 3 times a day to 3 times a week, technically that is considered normal. Any less frequent or more frequent is a sign that you may need to change something in your diet or talk to your doctor. Now, I personally think that going once a day is what you want to aim for and is probably the best sign that you got a good gut, good digestive system. Finally, let's talk about the thing that you cannot see, the microorganisms. So analyzing your poop on a microscopic level can actually tell you an enormous amount about your gut microbiome. Now, again, you can't simply determine the health of your biome by just looking at your poop. A sample needs to be clinically assessed in a lab to determine both the quantity and the different types of bacteria that are present. There is now some really strong support in the clinical setting for doing this if you want to screen for colon cancer, but we are also seeing a lot of companies that are coming out that are just assessing your stools to try to optimize your gut health in general. But we still got a long ways to go there, but I promise you it will be very common. It is going to be mainstream at some point. And this really is relevant, it is important because we are starting to link a healthy gut microbiome with so many short-term and long-term health outcomes. I firmly believe that a healthy gut equals a healthy you. So when should you actually be concerned? Well, if you have persistent changes in your bowel habits, unintentional weight loss, severe abdominal pain, blood in your stool, or chronic constipation or diarrhea, I would probably go see your healthcare provider. Okay, that's what I got for you today. Remember that your poop can be a pretty big indicator to your health. So stop ignoring what it's trying to tell you. And let's stop making poo taboo. Thank you everybody for watching. If you have any questions or want to talk about anything else nutrition related, drop it in the comments below. We can chat about it. My name's Jack, registered dietitian with Inc. Nutrition. I hope everybody has a delicious day. See you next time. You ready for a poop joke? Never mind, it stinks. You know, poop jokes aren't my favorite jokes, but they are a solid number 2. So that you can live a healthier, really handy guide to help us help us, what am I saying?